1. The nurse notes blanching, coolness, and edema at the peripheral intravenous (IV) site. On the basis of these findings, the nurse would implement which action first? 1. Remove the IV. 2. Apply a warm compress. 3. Check for a blood return. 4. Measure the area of infiltration. Answer: 1. Remove the IV. 2. The nurse has received the client assignment for the day. Which client would the nurse assess first? 1. The client who has a nasogastric tube attached to intermittent suction. 2. The client who needs to receive subcutaneous insulin before breakfast. 3. The client who is 2 days postoperative and is complaining of incisional pain. 4. The client who has a blood glucose level of 50 mg per deciliter, 2.8 millimoles per liter, and complains of blurred vision. Answer: 4. The client who has a blood glucose level of 50 mg per deciliter, 2.8 millimoles per liter, and complains of blurred vision. The nurse prepares to care for a client on contact precautions who has a hospital-acquired infection caused by methicillin-resistant Staphylococcus aureus, MRSA. The client has an abdominal wound that requires irrigation and has a tracheostomy attached to a mechanical ventilator, which requires frequent suctioning. The nurse would assemble which necessary protective items before entering the client's room? 1. Gloves and gown. 2. Gloves and face shield. 3. Gloves, gown, and face shield. 4. Gloves, gown, and shoe protectors. Answer: 3. Gloves, gown, and face shield. The nurse is choosing age-appropriate toys for a toddler. Which toy is the best choice for this age? 1. Puzzle. 2. Toy soldiers. 3. Large stacking blocks. 4. A card game with large pictures. Answer: 3. Large stacking blocks. A client with end-stage chronic obstructive pulmonary disease has selected guided imagery to help cope with psychological stress. Which client statement indicates the best understanding of this stress reduction measure? 1. This will help only if I play music at the same time. 2. This will work for me if I am alone in a quiet area. 3. I need to do this when I lie down in case I fall asleep. 4. The best thing about this is that I can use it anywhere, anytime. Answer: 4. The best thing about this is that I can use it anywhere, anytime.